I'm Dr. Agnelli with OC Doctors, and this is Hannah. Hannah, tell us what's going on with you today.
So about 2 years ago, I got in a car accident, and I started having really bad back pain. Sometimes it randomly starts again, especially like with the squat rack. When I'm using the squat rack, it hurts my back really bad, makes it really hard to like lift heavy. So I don't know if it's still because of the car accident or if it's just I'm lifting too much weight. I'm not sure.
Did you do any treatments after the auto accident?
Yeah, I did a few, but I didn't really show up to all my appointments. But yeah, I did a few.
Okay.
But still, my neck was like kind of not aligned, I felt like.
Okay, so that's what happens if we don't follow the treatment plan the doctor prescribes.
Yeah.
We may not get a full resolution within the spine. It'll come back residually with pain after.
I think that's what happened to me.
Okay, so let's go ahead and take a look at you and see what's going on.
Should I just lay down?
Let's go face down on the table here. And we got a couple little hand placements down right on each side there. Very good. Okay, we do have a leg length difference. If we put our thumbs on the bottom, but we're going to kind of measure at the top of the soles here, and then we're going to notice it's about 1/3 to 1/2 inch short on this left side. Now, as we bend it all the way up, we notice that it stays about 1/3 of an inch off still. Okay, so we have that going on. So that tells me there's a hip rotation going on this left hip. We can also visually see it on this left side. It looks like it's almost rotated around like that. Now, is there a little bit of pain?
Yeah.
On which side's worse?
On the right side.
Yeah. So a lot of times what happens is when we get a posterior inferior on the iliac spine on the left, it will actually create a body right on that L5 vertebrae. We're just going to kind of go right up the spine here.
Too.
What side's worse for you?
Right.
Right side. Okay. Okay. Now we're going to kind of get up into the area where you're feeling it a lot.
Yeah, right.
Right there on
Yeah,
that
there's
right
like
side.
a lot of tension there.
Okay, doc. And you actually have a reverse lordosis in the cervical spine. So the curve is going in the opposite direction. Okay. Okay, what I'm going to do is a little bit of rapid release to relax these muscles down. Let me know if it's too much pressure in here. How is it?
That feels good.
Good. Okay?
Yeah.
Alright. Okay, now let's get to work here. See if it's short on this left side. Okay. Alright, go ahead and take a breath in for me. And out, and just relax your shoulders, relax, relax. Very good. Okay, we're gonna do the left side up, face me over this direction.
Like this?
Yep, just like that. And then just lay down on the side, put your head right in there. Okay, and then straighten that bottom one, perfect. I'm gonna slide you right like that, good. And then lay on your back, perfect. Here we go, nice and relax. Very good. All right, let's go to the other side there. And just the top one in. just right here. Good. Okay, take a breath in and out. And nice and relax. Very good. Face up. Just let's lay back down on your back here. Okay, so we'll recheck this. Look at that. So we got the heels are heel to heel. If we look straight down. Okay. And then I also want to do a little look on her neck. Okay, so let's go ahead and face up. Turn all the way around, face up.
Okay.
There you go. That's okay. Up,
Just
slide
go
down.
back, or?
No, slide this way. And then go straight down. Perfect. I'm just going to kind of take a look at your neck here. So you can feel some tension right there?
Yeah.
Okay. So what I'm doing is I'm palpating the neck. I'm looking for areas that are subluxated. Tender right there.
Mm-hmm.
Okay, so I'm going to go real gentle on here, okay?
Okay.
Nice and relaxed. Good. How was that? Wasn't too
Yeah,
bad,
it
huh?
wasn't.
You're anticipating it more. Okay, and then just nice and relaxed right here. Perfect. Nice and easy. Okay. And then, good. All right. So come all the way up here. All right, Hannah, how did it feel?
It felt really good, like way better than I expected. I don't feel all that tension anymore. And the neck one I was really scared for, but that one was like nice and easy. So thank you.
You're very welcome.
So I'm here with the one and only Ashley K Fit. How we doing, Ash?
I'm good, but I'm stiff.
She's stiff. I mean, she is training for her show coming up, right?
True.
So she is, let me fix that for you. She is lean and she is strong and she's putting in work. So we're gonna do a whole body tune up for her and make sure she's dialed in. We're gonna start out with a little bit of space right there. Hamstring curl, Ash, push back. Hams are firing, that's perfect. Push back here. Beautiful. We're gonna go to her piriformis, push in this way. Okay, we're gonna bring that down, this one up, foot flat, pull in. Perfect. We're gonna lift up with the glute, push up, Ash. Go ahead. Bring your knee in a little bit. Push up, push, push, push. So her left glute is turned off. Try this one here.
Oh, we need that glute.
We need that glute turned
We
on.
need it.
Bend this way, and then we're gonna go ahead and push up. So both her glutes are turned off. So we're gonna go ahead and take a look at her hip flexors before we start working. We're gonna go face up now, please, Dick.
Okay.
There we go. All right, and hands
Glutes
off
are
the
the
body.
money maker.
Yeah.
I'm working.
We gotta take care of them, right?
Yes.
Hold your foot here like this, legs straight. Push up with your right leg. So her right hip flexor is shut off. We're gonna go over to her left psoas, hip flexor, push up. Okay, both of those are shut off. Many times when we have that, we have an upper neck misalignment in addition to poor muscle firing. We're gonna go here. I'm gonna pull this way, Ash. You resist, go. Try as she may. Ashley's super strong, but whew, looks like I won that one, Ash. Pull this way to the right. See, her competitive side is gonna come out now. Pull this way. Pull, pull. Yeah, no bueno. So we're gonna go to her quadratus lumborum, lower back stabilization muscle. Hold the legs to the left. Pull, pull, pull. Solid. Then we're gonna do a test and see if this will help the hip flexors. This leg comes back up, straighten out, push up here, push, push. Turning on her left lower back muscles gets her hip flexor to turn back on. We're gonna go face down, Ash. Thank you. Shoulders relaxed, hips relaxed. This doesn't feel great, but we gotta do it. So come on, Ash, we were talking just a minute ago. What are some of the secrets you can give to people that follow you, that know about your fitness journey, that are your fans? What can we tell them about the commitment, the dedication to getting the level of fitness that you've achieved and are achieving?
Well, gosh, you just gotta get a good mindset and keep consistent. You're gonna have days where you're not feeling like going to the gym or not feeling like eating food that's, or you might feel like you want to eat food that's not in your diet, but just like look at the bigger picture and think to yourself, is this piece of pizza really worth it? This 2 minutes of satisfaction, is it worth a lifetime of like health and fitness? So
Wow, that's
Yeah.
big. So you do have temptations.
I do, and it's okay to treat yourself every once in a while, but if it becomes a habit and it becomes an everyday thing, you know, that's when you gotta be careful.
Agreed. So having that bigger vision is huge. We're gonna
Yes.
breathe in, Ash, and breathe out. Now, hips relaxed. Stop breathing. Don't help me. This is a counter strain on the glutes. You might feel a stretching in the front. Breathe and relax. Cool. Feel relaxed. Okay, and now we're going to lay face up and work on your hip flexors.
It's interesting you said there's something about like upper neck, because that's where it's so stiff.
Yes,
Here.
yes.
So stiff.
Mm-hmm.
Like, and it's like I can't even massage it.
You can't shake it, right?
Yeah.
Yeah, many times when we have a bilateral hip flexor weakness. This is actually cool. Can we lift this up a little bit? Is it okay?
Of course, yes.
Come on. So the psoas, and would you just lower this a tad if you don't mind? I just want to use your anatomy to show people what's going on.
Exactly. You know.
The psoas is a hip flexor, so it attaches right in here, goes down underneath the intestines here, and attaches into the lumbar spine. And so that deep hip flexor does this motion here. And when it's not firing, that can create problems, can cause pain. But if we have both of them that are not firing, oftentimes there is an upper neck misalignment. So we'll get there in just a minute. Thank you, Miss Ash. We're gonna breathe nice and deep and out. Here we're coming to her left psoas, and we're going to release this muscle here. It's gotta hurt a little bit, Ash, but just keep breathing. You doing okay?
Mm-hmm.
Hips relaxed. Opening up the adductors. And then we're looking here. Knee rolls in just a tad. Beautiful adjustment in the foot. Hands off the body, please. We're going to bring the legs to the left. Go ahead and pull. Okay. Work on the hip flexors. Push up here again. Push. Excellent. Firing strong. This way. Push up here. Push. Very good, Ash. We're going to go this way. Pull to the right. And perfect. Let's go ahead now and have you lay face down, please. Check the hamstrings again. Push back, Ash. Strong. Push back. Push. Strong. We're going to lift up here, Ash. Up. Check the right glute. Now watch this. We're going to bring your knee in a little bit. And your foot, there we go. Just like that. Hold right there. Push up, Ash. Push. Right glute's firing. Check that out. Okay, bring it down. Lift this one up, Ash. Push. Strong. Solid, huh? We're going to breathe in and down. Shoulders relax. Lift your chin up a little bit. Beautiful motion in the lower thoracic. Breathe in again, Ash. Excellent movement. Can I have you lay onto your left side now, please, Ash?
Okay.
Thank you, dear. So, we're going to bend here. Hips relax. Perfect. We're going to do this here. You've got quite the lumbar curvature there.
Yeah.
Breathe in and out. Hips relaxed. I'm going to lean over you a little more. Started to move already. You got most of it there.
Kind of slipped itself.
Come on over this way. Okay. tummy relaxed. Go this way, like so, and breathe in. Wow, big movement. We're gonna lay on our back now, please. And relaxed. Checking that upper neck that we were talking about. Sure enough. Breathe in nice and deep. And out. There we go. Drop the head a little bit more. Wow.
Money.
So good, right?
So good.
Come on up. Last but not least, you face that way, shoulders relax. You want to just bust out a quick pose? I mean, oh no. Ah! Good. She's shredded. She's proud of her hard work. It's inspiring to see somebody that works so hard with the body, right? Head down, please. My hands go here. Yours on top of mine, Ash. Squeeze down. Breathe in deep. Fall back gently. Chest up. Squeeze a little bit, and then fall back. A little bit more. Fall.
Ooh.
Perfect. And then hands there. A little stretch. Chest up. And breathe. And out. Amazing. Turn around.
There we go.
Dialed in.
Woo!
She did it.
Feeling good.
Hey, who's your chiro?
You, duh.
Come on.
You,
Good job,
Dr.
Ash.
J.